class today is very interesting. Blood transfusion. That's the transfusion of the blood, or the blood transfusion is the process. There is mainly content. There is three steps. Okay, that's receiving the blood from the donor, the administration of the blood, and storage. Okay, receiving the blood from the donor and storage of the blood and administration of blood to the recipient. This is the main three stages and three steps. Today we'll finish up to the level of general instruction. Tell like, see, these are all the content I'll take in the class. First, definition, purpose, and components of blood, and grouping, and how to do the blood grouping and cross matching, and type of blood transfusion, and general instruction and procedure, and complication and role of nurse. This is the content. It is the process or transfusion of the whole blood or its components. I will tell what are the components of the blood. Now I will tell. Okay, there is a different components of the blood. In the form of red BC red blood cells, in the form of plasma, in the form of platelets. Okay, in the form of FFP frozen plasma. In the types of the blood or whole blood, complete PRBC, packed red blood cells. That's the transfusion of this whole blood or its components, such as blood cells or the plasma, or from the one person to the another person. This is the definition. This is 2 marks, from one person to another person, or from the donor to the recipient. This is the 2 marks question. Define blood transfusion in final exam or in the IA. Define blood transfusion andre this one. See, blood transfusion involves 2 procedure. Okay, 2 procedure. First one, collection, next storage and administration. First, collection of the blood from the donor or receiving the blood from the donor. Donor is who is donating the blood. Okay, donor means who is donating the blood. Okay, that is called as donor. Recipient, administration of blood to the recipient. Recipient means who is receiving the blood. That is called recipient. He is called as recipient. That is the two main procedure. In between, the nurse will do the storage. The nurse will do, or blood technician, blood transfer technician, they will do the storage, maintenance. There is another between this main 2 procedure that comes under this 2 steps. Between this heavy rain. See, the purpose of the blood transfusion. Before you enter into the procedure, before entering the general instruction or components or complications or anything, first you know the meaning or the and purposes, uses of the blood transfusion. Why? Okay, why blood transfusion? Why? See, first, to restore the blood volume when there is sudden loss of blood due to hemorrhage. Due to hemorrhage means a sudden loss of blood due to hemorrhage or due to any accidental case, in emergency condition, we need the blood. Or to we restore the blood to, by administering the by transfusing the blood. That is first purpose. To raise the HB level. HB means hemoglobin level in cases of severe anemia. Anemia means no blood or blood loss. Anemia means low blood, low blood in the person is called anemic patient. Low HB level, hemoglobin level low idre. To raise the hemoglobin level in that person, we administer the blood. That's second purpose. Third one, to treat the deficiency or problems or disorder of plasma protein or clotting factors or hemophilic globin. These are all some of the components. Okay, these are all some of the components of the blood. These are all the to restore or to treat the any deficiency in plasma protein. Okay, any deficiency in clotting factors. Okay, any deficiency in hemophilic globulin. Okay, to provide antibodies to those persons who are sick or having lower immunity. Okay, immunity is the, what is immunity? Immunity is the power. Okay, immunity is the power, the immunity that will save the, okay, the immunity that will save, that will work as a soldiers in our body, that will save the or kill the all the microorganisms. Okay, immunity is power that will show the creativity, and that will show the capacity to kill the all microorganisms present in our body or enters the new. If you walk in the dust area, after finishing the walking, then after 5 to 10 minutes you cough alva, ಕೆಮ್ತಿರಲ್ವಾ, you cough or sneezing, that is show your good immunity power. Okay, immediately coughing or immediately sneezing, that will show the good immunity power, and that will uh, in the dust area that will all comes out. That is the immunity power. Okay, if you're not sneezing, okay, if you're not coughing at that time andre, that shows your low immunity power, and after after 10 days or 12 days you will start your asthma patient, asthma and some disorders. Okay, that is the immunity. In that time the immunity, if your lower immunity means, if the patient having lower immunity power, this blood transfusion provides the antibodies to the person who are very sick. Okay, and to replace the blood with hemolytic agents with fresh blood. Okay, and to improve the leukocyte count in blood as in granulocytosis. Okay, to improve the leukocyte, to improve the WBC white blood cells count. Okay, and to combat infection is leukopenia. In leukopenia is the one of the blood disorder. Leukopenia is the decreased the red blood cell, that is disease is called leukopenia or infection. Okay, in these are all the some of purposes of blood. In this condition we have to administer the blood to the patient. See the components. Here are total 5 components. First, each unit of blood is tested for evidence of hepatitis B, C, HIV or syphilis, malaria, and one more thing, syphilis, malaria, STD, sexually transmitted disease. These are all the before administering the blood, after taking the blood, receiving the blood from the donor, or during the administration of before administration of blood to the recipient. These are all the tests we have to done. Okay, not by our nurses role. This is the complete role of the blood transfusion technicians, lab technicians. Okay, laboratory technicians. See, each unit of blood that is tested for any evidence of any positive case of any hepatitis disorder, any HIV virus present in the blood, or any syphilis or any sexual STD or any malaria. These are all the tests they will conduct before start transfusion of the blood. Okay, the blood is then processed into subcomponents. These are, see, the blood, you receive the blood from the donor. Okay, blood from the donor. For example, you receive the blood from the donor, 350 ml blood you receive from the donor. The blood, the receiving that blood, that will, you can administer that blood into 8 members. 8 EIGHT, 8 members. You can administer that blood into the 8 members in the form of different sub components, in forms of whole blood, the form of whole blood, or PRBC, packed cell volume, or FFP, plasma plasma, in the form of platelets, in the form of cryoprecipitate. See, these are the 5 forms. You can administer the 8 members to the recipient. Okay, see, first one, whole blood. What is whole blood? Whole blood is unseparated blood containing an anticoagulant preservative solution. Okay, see, whole blood that contains 450 ml of donor blood. Okay, total 500 ml of donor. Okay, total 500 ml of bag. That's whole blood. The whole blood contains total 500 ml of blood. In that, the 1 unit of whole blood that contains total 500. In that, 450 ml of donor blood. Who donating the blood, they will donate 550 ml of blood, that is donor blood, and remaining 50 ml is anticoagulant preservative solution. Already the anticoagulant preservative solution present in the receiver, the bag. Okay, that unit bag. Okay, no any functional platelets are added in that blood, and hemoglobin across approximately 12 gram per ml, and hemoglobin that then blood. Okay, see, this is the unseparated blood containing anticoagulant and preservative solution. The whole blood total is 500 ml of whole blood that contains 450 ml of donor blood, and with plus 50 ml of anticoagulant preservative solution. This is already present in that unit bag. See, stored between +2 or plus not minus, +2 or +6 degrees centigrade in a blood bag refrigerator. and transfusion should be started within the 30 minutes after removal from the refrigerator and completed within 4 hours of commencement, because changes in the composition may occur due to red cell metabolism. Okay, it will start growing metabolism agi that will start dying of new cell old cells and starting a metabolism of the new cell. That's why you have to, before transfusion, you have to check the, I will tell the procedure. Before starting, you have to check the transfusion. It should be started within 30 minutes. Okay, the whole blood is stored between +2 or +degree centigrade in the blood bank refrigerator. After removing that whole blood component, whole blood unit, okay, bag unit, complete from the refrigerator. You have to complete that one within the 4 hours. Within the 4 hours, before changing any color or before changing any thickness of the blood, you have to administer the blood in within the 4 hours of the commencement. Okay, this is some of the tips. Next, PRBC, packed red blood cells. PRBC, this is very common in nowadays. Whole blood is rare. Whole blood is not in every blood bank. That's whole blood is rarely present. Not every every blood bank is not produced or not receiving the complete whole blood. That's rare. Whole blood is rare. PRBC is very common. PRBC, packed red blood cells, it's very common in, it will be available in every blood bank. Okay, packed red blood red cells are cells that are spun down and concentrated. 1 unit of PRBC is approximately 330 ml and has an hematocrit of 50 to 70%. Hematocrit means it's preventing the clotting of the blood, anticoagulation. It works as an anticoagulation. That is called hematocrit. Okay, it works as an anticoagulant. It prevents the clotting of the blood. That's one of the chemical or one of the component. They are stored in saline adenine glucose mannitol solution to increase their shelf life to 5 weeks or to 2 to 6 degree centigrade. Okay, they are stored in the SAGM, saline adenine glucose mannitol. These are all the one marks question. Okay, this is all the one marks question. Or they may ask, write the components of the blood ಅಂತ ಕೇಳ್ತಾರೆ. Components of the blood, or explain the components of the blood ಅಂತ ಕೇಳಿದ್ರೆ I have to explain these all the things. Next, that's about PRBC. Now, press frozen plasma. 1 second, Anantika is waiting in the lobby. One second. Blood transfusion, that is components. Stop there. If P press frozen. Okay, FFP, I stop this slide. That's about packed red blood cells, PRBC. Next one is the press frozen plasma. This is very common. This type of blood is administered. This packed red blood cells is administered in the case of any low low hemoglobin rate, low hemoglobin, and in the, especially in the accident cases, emergency cases, or any blood loss, hemorrhage or blood loss in the body without knowing by the patient, without knowledge of the patient. The blood is lost continuously in the form of stools. Okay, in the form of stools, in the form of any hemorrhage, any that is some of the disease condition that may be loss in the blood loss in the body without knowledge of the patient. In that type, In that condition, we administer the packed red blood cells. This is press frozen plasma. This is in the condition of this one, dengue. Okay, low platelet count is the low platelet count. This is the press frozen plasma. Or in the time of liver disorder, time of cirrhosis, liver cirrhosis, or in the disease condition of the liver cirrhosis or jaundice. Okay, jaundice, cirrhosis, some of the abdominal distension. These are all the condition. They'll administer the press frozen plasma. This is rich in coagulation factor. Okay, rich in coagulation factor. You administer this in more than this is press frozen plasma. You finish within 15 to 30 minutes. There is no any complication or no any problems. This is very it is like a normal saline in the blood forms. It is like a normal saline. Okay, saline type. This is press frozen plasma. You don't need to worry. Okay, no need to worry. Store the blood. Store these components in the refrigerator in -40 and -450 degrees centigrade. Okay, with 2 years. This validity is 2 years. Give more than 2 years, you can store this type of blood. It is first line therapy in the treatment of for coagulopathic hemorrhage. Okay. Next, cryoprecipitate. Cryoprecipitate, this supernatant precipitate of press frozen plasma and rich in factor 8, 5, 6, 7, 8, factor 8 of the chart in the physiology subject. There is one chart, coagulation factors in the factor 8, that is fibrinogen factor 8. Okay, this is cryoprecipitate that is rich in this factor 8 coagulation factors stored in to -30 degrees centigrade with 2 years of shelf life. Okay, in the case of any low fibrinogen, in the case of any decrease the source of fibrinogen and intravascular coagulation. Okay, and food units containing 3 to 6 grams fibrinogen. See, this is the administered infused within the 6 hours after taking from the after taking out from the refrigerator. Administered within 6 hours. It may be poisonous of the that is about components of the blood transfusion. Next, see, this is the four main blood grouping and cross matching. A, O, A, B, B. See, this is about blood grouping and cross matching. There is so many types of blood group. First O. Okay, O can donate the blood. Okay, O can donate the total. See, first A, B, ABO. ABO is the blood grouping and cross matching type. First A positive, B positive, B negative, A positive, A negative, O positive, O negative, AB positive, AB negative. This is also some of the blood types and blood groups. See, each person has one of the following blood types: A, B, AB, or O. Okay, O can be given to any one but can only receive O. Okay, O can be given to any one. O can be given any one. Any A positive, RH positive ಆಗಿದ್ರು ಕೊಡಬಹುದು, RH negative You can give any type of blood group persons. Okay, who is the universal donor? Who is the universal donor? The O positive person or O negative person or O blood group person, they can give anyone A positive or B positive or AB negative or AB positive or O positive or any ಯಾರಿಗಾದ್ರೂ ಕೊಡ್ಬೋದು, anyone. But the O is only can receive the blood only the from the O donor, only the O donor. Okay, that's why the O is called universal donor. Universal donor. ಏನಿದು waiting in lobby ಅಂತ ಬರುತ್ತೆ. Okay, see, like that. AB can receive any type of blood, can only be given to AB is the universal recipient. Okay, universal recipient. Okay, AB is can receive any type of blood group. It may be A, B, O, any type of blood group. They can given only the same blood group. And now I am the AB positive. Okay, you are all some of them A positive, and I cannot donate the blood to you. I cannot donate the blood. Okay, if you are AB negative or AB positive, and I can given the my blood to AB positive same group, that is AB. Also every person's blood is either RH positive or RH negative. Okay, that's RH factor or RH positive or RH negative. Now I will tell what is it. The blood is used in transfusion must be compatible with the patient's blood type. Type O blood is called universal donor. See, the people with type AB blood are called universal recipient. Okay, people with RH positive blood can get RH positive or RH negative blood. RH positive and RH negative blood, but people with RH negative blood should get only the RH negative. A negative idre can administer the only A negative. RH positive idre can get RH positive or RH negative blood. People with RH negative idre, the blood should be get only by the RH negative blood. You cannot infuse the only RH negative. The patient having RH negative andre. See, tomorrow I will tell the procedure for blood grouping. Okay, how to do the blood grouping anta tomorrow I will tell. Tomorrow I will tell the what is the procedure for blood grouping out. What is the technique used for testing the blood grouping. Blood transfusion. There is 3 types of blood transfusion. First one allogenic, someone else blood, or autogenic, own blood or exchange of blood transfusion. The commonest procedure is exchange blood transfusion. Exchange blood transfusion or common procedure is allogenic. Allogenic is I donate the blood. The next time you try to join in the Zoom app, I don't like this app. This suddenly sounding some problem in this one. Allogenic, keep in mind this 3 steps is very important. Allogenic is someone else blood. I donate blood to you. That is allogenic. I donating the blood to you. Okay, someone else, you don't know, XYZ person is donating the blood. That is allogenic blood transfusion. Autogenic means my blood, my own blood, administered the or infusing my own blood to me. That is autogenic. Own blood infusing the same blood or own blood to the same patient. Okay, same blood, same patient, own patient. Okay, that is autogenic, own blood. Exchange of blood transfusion, See, now I am A positive. Okay, my relatives went for searching the blood, A positive blood in the blood transfusion or blood bank. Okay, they will donating the blood, they will donating the B positive blood, and then will receive the A positive blood. Okay, that is exchange of blood transfusion. Okay, that is exchange of blood transfusion. This is the main three step types of blood transfusion. General instruction regarding selection of donor, then collection, storage, and administration of blood to the recipient. Okay, now I'll tell the what are the general instruction for about the selection of donor. How to, what is the this one, rules and regulations for selection of the donor, and what's the rules and regulation of collection and storage and transportation of blood, and what are the rules and regulation of administration of blood to the recipient. General instruction. See, first, selection of the donor. If you select the donor of the person is donating the blood in any functions, okay, any star birthday, okay, any star in Malayalam is the star Mammootty, superstar Mammootty or something. Okay, in Canada, some of the superstar Darshan or some of the stars in birthday celebration, they will donate the blood. Okay, they will donate the blood. In that time, you don't receive the blood. First, to selection of the donor is you have to check the patient is either TB positive or tuberculosis, cancer, jaundice, HIV. These are the tests you have to run before receiving the blood. Selection of the donor, and make sure that the donor has not donated the blood within previous 90 days. Within previous 90 days, make sure that that person, the donating person, that way they will not okay, they will not donate any type of blood, any blood within previous 90 days. Okay, physically, and third point, he is able to physically active, and it is must stand between is must he or she is between the age of 18 to 65 years. Okay, with normal or average height and weight. Okay, donor must have normal vital signs, normal temperature, normal BP, normal hemoglobin level, normal pulse, normal respiration, and must not have been pregnant within last 6 months. Okay, this are all the rules and regulations you have to keep in mind when you selection of the donor. And HB level is must be about 12 gram percent. Okay, 12 gram. And donors are disqualified with history of any recent dental surgery, any major surgery, any receipt of blood or blood components or immunization, and explain the procedure to the donor first, and after that explain procedure to the donor. The main thing, you should not connect or should not collect the blood the person is not having any food, empty stomach, should not be dehydrated. Okay, and following the donor should be offered sweet and drink, asked to take rest, and main thing, keep in mind, the person is don't not alcoholic and not smoker at that time. Make sure that the person okay, donating the blood, make sure that that person donating blood not any history of any alcoholic, or to present time it's an alcoholic, not an alcoholic and not a smoker. Check afterwards, receive the blood, empty stomach. And after the finishing the donating the blood, you have to have to give the sweet and drink, apple juice, like that. Okay, apple juice, and given apple or given fruit, or ask to take rest at least 1 to 2 hours to prevent the paint, that means pain, to prevent the giddiness. Okay, tale ತಿರುಗೋದು. And before leaving the collection center, donor must be observed for any giddiness, color changes, and check what is frequent. Okay, before leaving the collection center, ಏನಂದ್ರೆ some stars birthday, they will put one tent. This blood is heading blood bank, we come from blood bank, we receive the blood, they will put on banner. Okay, from the program, blood bank blood receiving program, they will put on the emblem, something, they will put the chart, and they will start the donating the, they will start receiving the blood. In that time, all are going giving the blood. That time, before leaving that collection center, donor, before leaving the donor from that collection center, okay, I have to check the, you must, the receiver, the nurse must check the, observe the patient for any giddiness, any color changes, any blue colors. Okay, any color change, you have to check that one. And check the vital signs frequently. Okay, check the vital signs, BP, blood sugar, ಇದೆಲ್ಲ you have to check. See, that's about the selection of donor, roles and responsibility rules. Next, how to collect the blood and how to store the blood and how to transport the blood from one place to another place. See, first donor's blood immediately after it is withdrawn should be placed in the immediately you have to place the blood that's received from the donor immediately place the blood in the refrigerator, and stored blood should be inspected daily or before use of any evidence of hemolysis or bacterial contamination, and any bacterial present in the blood or any hemolysis means any breakage of blood, any breakage of red blood cells. Okay, any clotting agila, clotting is not easy, there is on clotting factor is present inside the bag. You check for any hemolysis. Lysis means breakage of any blood. Okay, breaking of any blood, you check the any that type. You have to inspect the blood in every day, inspect the blood, check the blood, and transportation of blood should be hospital should be done within 30 minutes after it is taken from the place of storage. You taken the blood from the village side, okay, shibira, some of the program you arranged in the village side. After receiving the blood, receiving the blood from the donor, you have to should be done within the 30 minutes. Okay, you keep the blood or receive the blood or reach the hospital within 30 minutes from the area. Okay, next, if the blood is kept at the room temperature, the temperature blood will rise about 10 degree centigrade in 30 minutes, and the blood is not used, it should be returned to the refrigerator within half an hour, and the blood is transported to a distant place. Use pre-cooled insulated bags to keep the temperature of blood below 10 degrees Celsius. This is the collection, how to collect the blood and how to store and transportation. Next, collection of the blood from the donor is done in laboratory or any laboratory by laboratory technician, only laboratory technician, not any group D employee, any sweeper, that's a doctor also or nurse. It is only collection of blood is only from the laboratory technician. Only there is no laboratory technician, the nurse will know everything. Okay, nurse will know everything. In that situation, the nurse can receive the blood. Nurse can receive the blood. Okay, donor's blood is collected in sterile container containing anticoagulate solution, electrode, and all the articles used for the collection of blood must be sterile articles have to use in the during the blood collecting procedure, and each donor unit must be labeled clear readable letters, name donor. I will tell this point in the next slide. See, administration, when the sending the recipient's blood sample for the grouping and cross matching, it must be clearly labeled with name, IP number, bed number, ward number. Okay, your relatives, any one of your relatives admit in the ward, admit in the medical ward, the doctor or PG told them, see the you have to collect the, you have to bring the blood for administration. They will write the slip and give it with the blood. Okay, with two small okay, with the blood sample, you searching the blood, and then finally got on blood bank. Then you enter into the blood bank or blood reception time. Again enter into that time. After entering, they will ask the blood sample of the patient. Okay, blood sample of the recipient patient. After they receiving the blood, first they will check the blood grouping in the blood bank, and they will do the cross matching. Cross matching means cross matching of the blood, if any cross matching of the recipient blood, and they will give on blood for administration for the infusion to the recipient patient. That blood also, that blood and with your patient blood, they will do the cross matching. That is called cross matching. They will check the cross matching. The blood is now any reaction with 1 ml of your patient blood and 1 ml of the donor's blood. They will cross matching in the blood bank only. They will cross matching. After cross matching, there is no any reaction. There is no any breakage of hemolysis. There is no breakage of any this one. any other disorder andre they will clearly labeled the patient, they will clearly label the name, IP number, bed number and ward number. Okay, fresh sample taken within 4 hours should be used for typing, blood grouping and also cross matching. The request form should be accompanying with blood sample and form should contain the form that is given by the doctor. That form should be in name, IP number means inpatient number, bed number, ward number, name of the physician. ಯಾಕೆ ಎಲ್ಲರೂ ಲೆಫ್ಟ್ ಆಗ್ತಾ ಇದ್ದಾರೆ? ವೈ ಆಲ್ ಆರ್ ಲೀವ್ ದ ಮೀಟಿಂಗ್? ಇಟ್ಸ್ ನಾಟ್ ಗುಡ್ Scowebex. Of the physician, exact amount of blood they wanted for administration of to the patient and diagnosis of patient problem, any blood transfusion given earlier, okay, and group of type of blood, admission, any reaction observed in the previous any blood transfusion, any previous day any transfusion that patient. These are all the form, these are all the contents, these are all the contents that will written by the your doctor, your physician, and this form should be given to the over to the blood bank technician. After they will check all these things, they will give 1 unit of the blood or how many amount of blood bekanta they will give. It is essential that the physician writes all the orders with the typing, the cross matching with administration of whole blood, which type of blood they wanted the physician under they will write and give. Prior to administration of blood, 2 registered nurse or physician verify all the information and report of cross match, unit label, patient's identifications. If there is any discrepancies, the unit should be returned to the blood bank with remarks. If any leakage of in the blood unit, any leakage in the blood bag, not any cross matching, report of cross matching is not positive, it is not good, and it's not labeled or expiry date or date of collection is expired, date of expiry of the blood is expired. Okay, these are all the conditions. If you observe, if anything is wrong, you immediately you send that bag return to the blood bank with remarks andre scold something, you don't have any comments anta you scold, and with remarks you send that bag back to the blood bank. All blood or blood should be transferred through an appropriate or style transfusion set containing the filter. I will tell afterwards. Transfusion set should be free from hair. Use 18 gauge needle for transfusion. No medication or other additives should be given. The same IV route should not be mixed with blood. See, underline this one. No, during the blood transfusion, no any medication, no any other additives. Patient complaints of vomiting, headache, vomiting or fever andre you don't administer any type of IV injection to the same IV injection to the same IV route or same IV cannula. If the patient having any chills or any fever or any headache, any gums bleeding, immediately stop the blood. Okay, stop the blood transfusion. Immediately call the doctor. Immediately show the doctor to the patient. That's your immediate reaction to the any complications of the blood transfusion. Don't mix up any injection with the blood, that will may cause patient may die also. Okay, that's why don't give any IV injection with the same IV route, that will not mix up with the blood. Yes, and keep the patient warm, comfortable if necessary. Offer bedpan before starting the procedure. Okay, record the amount of blood, type and group, rate of flow, any reaction and any medication administered. And IV infusion should be what is that rate of flow 5 to 10 ml. See, this are all the points about the procedure. I will explain the complete procedure. These are some of the general instruction during the selection of the donor and collection of the blood and storage of the blood and transportation of the blood. Finally, the administration of the blood to the recipient. These are all some of the general instruction.